Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host. Today we have back our guest from last week, Kimberly White. Kimberly, welcome.
Thank you.
And we also have my colleague and great business partner, as well as my wife, all three of those in one, Dr. Adriana Corridor. So welcome.
Thank
Adriana,
you.
glad to have you here too. We got a lot of questions from our spark from our interview with Kimberly last week. So the three of us, with taking Kimberly's lead, will answer these questions that parents wrote in or called in and had. So, Kimberly, you ready to get started?
Let's do it.
All right. So, how do I know if my child needs myofunctional therapy? What are a couple of things parents can look for?
Sure. A few things they can look for is look and see how your child's breathing. Okay. You want to make sure that they can breathe through their nose, that their mouth is not open. Check in on them and see how they're sleeping. Are they sleeping with their mouth open? Where's their tongue? Their tongue is always down low and forward. That's a problem.
Okay.
Okay. And listen to their speech. Is it crisp and clear and precise? It should be by the time they're 3.5, an unfamiliar listener should be able to understand your child.
Okay.
So if you're having to still interpret for them at that age, it's time to maybe get an assessment, see what we need to do.
How would you, this is a question that I have, how would a parent discern between what really is a speech issue versus a child that just might be timid? You know, and because I know some children you talk to and they're just boisterous and they're really good with adults, and then others are a little bit reserved and they mumble. Is it more like how they talk when they're around people they're comfortable with?
Yes, absolutely. Yeah, because a lot of kids are shy and timid, but you know, how is their speech when around mom and dad, around their siblings?
Yeah. Okay.
Yeah, that's what you want to look for. But mumbling is something very different versus just articulation. If they mumble, especially at the conversational level, there might be something going on.
Okay. Okay. All right. Great.
I have a question, Kimberly. As a matter of fact, we had a patient the other day that the mother was bringing him for tongue tie evaluation and had been recommended in the past that he have his tongue tie released. And one of the bit of information, as in talking and discussing his issues in the past, was that when he was 2, he started talking and seemed to be talking appropriately for his age and starting to pronounce words and all that. And then about a year later, he just stopped and was babbling more and mumbling and was pointing more at things. What would you say was occurring or happening, or as a parent, you know, what are red flags to look for, or what do we do? Where do we direct a parent in that situation?
Always, if there's regression, we need to have a speech and language evaluation. Sometimes that's indicative of something else is maybe going on, a receptive or expressive language delay, possibly maybe some signs or symptoms of autism. If you have a kiddo who's really verbal and then all of a sudden there's a digression and they're not as verbal anymore, that's definitely something you need to take a look at.
Okay, great.
Yeah, I would think that any time a child starts acting, you know, drastically different,
Right.
There's something going on.
Right.
So, just kind of in a nutshell, what happens? We showed what happens in a myofunctional session, but for those that weren't able to see it, or maybe those listening on the radio podcast, what generally happens at a typical myofunctional therapy session?
It is very laid back. I always tell my patients, today is the only day I'm going to pick you apart. But it's my job to look at the pieces of the puzzle and put it all together. So I'm going to take a thorough case history. I'm going to have that patient eat. I'm going to see how they eat, how they drink. I want to see what's going on with their tongue and their lips. I'm looking for some things there. And then I'm going to take a look inside the mouth. I'm going to see how the tongue lips, how the works
How the tongue works.
how the tongue works, how the lips work, and how they all coordinate together. And then I'm also going to assess speech, not solely at the word level, but at the conversational level. How I just got tripped up. Okay,
Yeah, right.
like if they consistently get tripped up when they're talking quickly, or maybe they're tired at the end of the day, we're going to look at that.
Yeah.
So a real thorough case history is real important. We're going to look at breathing, we're going to look at sleep, we're going to look at airway, all those things together.
Can I look up myofunctional exercises online and just have my child do them and just do that alone?
That's a good question. I get that often. Myofunctional therapy is not a cookbook approach. It's not. There's not a one-size-fits-all recipe, right? So my evaluation is going to break everything down. I'm going to look at where you or where your child has deficits, and then the exercises that we're going to do are going to be tailored for that specifically.
Yeah.
So my pat answer would be no, because there's no sense in doing some exercises. You need to only do the exercises that you or your child need.
Yeah.
So you
It's a program specifically for that person.
Right, it's
You're not gonna get that
tailored
online.
specifically.
Yeah.
Yeah.
Plus, it's people that go online and look up weight training. They could actually hurt themselves if they don't have a trainer telling what they do.
Right.
You're probably not going to hurt yourself from a standpoint of a pulled muscle in your tongue, but you could hurt yourself if you're not doing the exercises right. You could actually be reinforcing something that's
Reinforcing
not
some
good.
negative. Yeah,
Yeah.
absolutely.
yeah.
And also the importance of collaborating with other specialists. You may be sending that patient, referring them to an orthodontist or to us, for example, so that we would be looking at certain things that under development that could be affecting that as well. So starting it or acknowledging it, noticing it early on can really change the development and growth of that child. So I would think that it's not a cookie cutter like you said.
Right. And there's a systematic approach
Yes.
to it, and we want to catch it earlier rather than later. So
Yes.
yeah, good point.
Here's a big one. And I think I really want parents to perk up the ears on this one. Let's talk about pacifiers. Is just a blanket statement or question here. Is pacifier use okay?
Yes and no. Pacifiers are okay for a while. You need to ditch the pacifier by 6 months. If you can do it, the earlier the better. That pacifier just trains that tongue to be down low and forward in the mouth, and the lips are open. And everything we want is for those lips to be closed and that tongue to be lightly suctioned to the palate. Now there's a time and reason for a pacifier. Maybe a preemie. A preemie needs to learn how to suck, so they need that pacifier. A normal developing baby, they don't need a pacifier, because all that's going to do is push that tongue down.
So if the parents out there do use a pacifier, you said you need to be weaned off of it by 6 months. So up to that point, how would they use a pacifier? In what manner would they use it? They're not just sticking it in their baby's mouth every time they cry and leaving it in there for hours, right?
Absolutely not. Yeah, just use it to soothe and then try to take it away as soon as possible. You want that child to learn to soothe themselves.
Yeah.
Yeah.
So if they take the pacifier, go to sleep, then just remove it.
Pull it out.
Yeah. Okay. And we were talking about some things too, the way to wean kids off pacifiers. One was, I thought this was interesting, you can like cut a piece of it off or poke holes in it, so it's not as effective. And that was one of the suggestions in a book that we were reading. What's that book? That's a really good book. Do you remember the name of it? We'll put it up. We'll put it up at the end of the broadcast. But I'm sure it's a book that Kimberly would approve. If it's not, we won't put it up there. Is there a certain brand of pacifier or a type of pacifier in general, that how it's shaped, that you would recommend if you have to use one?
If you're going to use a pacifier, do not get the ones, I wouldn't recommend the ones with the big bulb at the end, and definitely not one that has two parts, that hard plastic. You're just asking for some injuries there. So you want it to be all one piece.
Oh, okay.
Those
Yeah.
big rubber ones that they'll send home from the hospital.
Yeah.
If you're going to do one, that's the one I would do.
Okay.
Yeah.
And we also read about in this wonderful book, which I can't remember the name right now, that fit a pacifier to your child's mouth. They're not all the same, and different sizes for different children. I forgot some of the guidelines on that, but
So we're what he's talking about is they were recommending and working with lactation specialists more and more now as I get ready to do infant releases. Of course, they also recommend lactation specialists not to introduce a pacifier after 2 to 3 weeks of birth, because you don't want that to interfere with breastfeeding, because it's so important to try to promote the breastfeeding. But things that you can, and we have to be realistic. Some kids are going to need it. They need that calming, soothing that they receive from using a pacifier. But if you're trying to wean them off, it was saying, their suggestions are, cut the end of it. Then you have to be careful because it can get infected or dirty, so then you have to throw it away. So basically, if you start doing that, it's a one-time use and then you toss it.
Absolutely, yes.
But the other thing that was also talked about and reinforced was positive behavior or changing a behavior. And usually when you change a behavior, you replace it with an appropriate one. So, and depending on the child's age, at 10 months, they're starting to now chew more, use their muscles to eat harder foods, and so you change that. So you start introducing sipping water, chewing on objects that will help stimulate their muscles for growth and development. Mm-hmm. So that was an advice or a suggestion, cutting it off, but also replacing it with another positive behavior or an appropriate behavior for the age of the child at the time.
Yeah, I think one of the examples they use is when the pacifier's not in their mouth. So Emily, you have such beautiful lips. I love it that I can see them. You don't have that pacifier in your mouth, reinforcing that. You talked about sippy cups and things. You've got something really interesting here.
Yes.
Kimberly, tell us a little bit about this. What's it called?
This is a cup by Easy Peasy. It was designed by a speech pathologist. I can't think of her name right now. But parents often ask me, which sippy cup should I use for my kid? And I did a little research, and a speech pathologist, a doctor, a developmental specialist is not the person who designed a sippy cup. An engineer designs a sippy cup.
Interesting.
Because he wanted to keep his carpets clean.
Oh.
We all want our carpets clean, right?
Right.
But the sippy cup does not facilitate the muscles.
Right.
It doesn't facilitate the motor movements that we want for kiddos. A child as young as 6 months can learn to drink from an open cup. Yeah. Now there's one smaller than this, but I like this because you can see I can squeeze it. And I love this because it facilitates the lips getting over the cup. It facilitates that lip closure that I want, and the sides of the tongue coming back like we want it, like we need for all eating and drinking. So my answer is there's a time and a place for a sippy cup. I'm a parent too, I understand. But as soon as you can move that little one to an open rim cup, the better off they're going to be for speech and language development and for eating and drinking.
Yeah.
And I would think also for motor skills.
Absolutely.
You're trying to hold something and you have to keep it from spilling over, and which is probably why an engineer designed it.
Right.
Because, you're going to have spills. But again, I think in knowing the importance of, you want to develop their motor skills, that's going to help too, to help, wean them off the sippy cup.
A small price to pay for the advantages of not,
absolutely,
of having to, for lack of better words, work for your drink.
And if they have a sippy cup and they're walking around all day with juice, which obviously we don't want them to do, but they're drinking all day, then they're not going to be hungry too, right?
That's true.
So that's going to facilitate, that's going to help them develop into particular eaters or selective eaters. Right. So really drinking should be for hydration.
Yeah.
And at the table or at their high chair. So.
If you really think about it, if we started our child from very early age just drinking water,
they wouldn't want the other stuff.
They wouldn't want the other stuff. Right. So, water's not going to stain your carpet.
There you go. Yep.
Not like, apple juice or cranberry juice. So really and truly, sippy cups, I think we can all agree that those are just, don't use sippy cups.
Ditch the sippy cup.
Yeah, ditch the sippy cups. How about bottle use? What do you think about that?
Need to eliminate that bottle by 12 months and go to the open rim cup as soon as possible.
Yeah, and so for mothers that are able to nurse, I know there's certain conditions that a mother may not be able to nurse, but if they can, we really a limited use of bottles, maybe if you're going to a restaurant or something like that, and you need to, that's kind of a controversy on whether but for the most part, the child should be
moved to a cup
suckling from the breast
Yeah, the breast or an open
Yeah.
cup as soon as possible.
Because we know that if a child suckles from the breast, they've got to work for it. So they're developing their tongue position, they're developing their lips, they're developing their cheeks. When you put a bottle in their mouth, it's just kind of like feeding them with a fire hydrant. They don't have to work for their food, and that's when they become colicky. They get when they're feeding from the breast, they've got a really nice seal,
Latch.
so they don't or a latch. They don't get air, down in their stomach, and so then they don't become colicky, and you don't have to burp them. They don't have a reflux, and so just a lot of good, positive things to come from breastfeeding. But if you do have to bottle feed, just limit it as much as
Nutritional
possible.
value only. Just don't let that
Yeah.
baby carry around that bottle.
The reality is that it's not for everybody. Not everybody can do it. But a lot of it too is knowing the positives, understanding why it is important to try to breastfeed, and knowing that and knowing the benefits, it helps you to counteract the negatives of bottle feeding. And so, and one of them is, of course, and we talk about to our patients all the time, is the growth and development. But more importantly, when you're breastfeeding, the nipple goes deep into the mouth of the baby. So it helps to keep that form of the palate, of the roof of the mouth, and then developing, because it's so soft when they're little. And so a bottle can't do that. A bottle actually will create a high arch, and then that later on, the child can develop sinus issues because their nose don't form right. And so there's negatives to that. But I think a lot of it is, letting parents and understanding the benefits of what the differences are between breastfeeding and bottle feeding. Because there are some exercises. What can you do? There are some things that can be done to help keep encouraging that child to develop if they have to be a bottle feeder.
Yeah.
So, and that's for a whole other episode. But there is a lot of things that can be done.
Right.
It's all about knowledge and knowing. That's the most important.
What about proper tongue position? I know we've, talked about this several times last week and even today. But a parent, other than like watching your child sleep and their mouth is open, we know their tongue is down. Are there any other signs that a parent can be looking for improper or proper tongue position?
There are, and I think there's a slide that we could probably pop up that shows you. So if you look at that there, that's improper tongue position right there. You see how that tongue is down low and forward and even pushing through the teeth? Mm-hmm. So if you see that when your child is talking, when they're eating, or when they're drinking, that's improper. That you should not see their tongue. It should always be lightly suctioned up to the palate and back. And even when they swallow, you shouldn't see the tongue go forward.
Well, in the bottom picture, you can actually see how this tongue is negatively affecting the dental arches. The teeth are, up and down and kind of all over the place. And that's because the tongue is kind of ruling the roost there.
Right, yeah.
Yeah, those are great pictures, by the way. Thanks for bringing those. How should a parent, this is a good question. If my child has speech issues, we know that the child, maybe at a certain age, they're not really conscious of it yet. That might be easier, but you have a child that's self-conscious of their speech issues. And how do you talk to your child about that? And how do you, when you're taking them in to see a licensed speech pathologist, how do they go about that and explaining to their child what's going to go down and happen at an appointment with you?
I always encourage the parent to tell them first of all, nothing's going to hurt. Miss Kimberly is just going to listen to you talk. We're going to look at some pictures. We're going to see what we can do to help you. We're going to see what we can do to make things easier for you. And I'll often ask the kiddo how they feel. How do you feel when you have to repeat yourself? Or how do you feel when people don't understand you? And I think it's all about relationship, developing that relationship with that kiddo first.
Do most kids, when they realize they have a speech problem, is it because they hear it themselves, or is it because someone else told them, or maybe kidded them or teased them?
Years ago, that would have been the case. I think we all have done a really good job these days of teaching children to be kind. And I'm really surprised how often kids don't even realize that they have a speech problem because their peers have not brought it to their attention. I think that says something about us, how we parent today, because kids are a lot kinder than what they used to be. That's great. But it's also not great because there needs to be a little peer pressure to make them, you see what I'm saying? So it's not like it was maybe even 20 years ago when kids were embarrassed. Some kids don't even realize that they have a speech delay, or that their R's don't sound correctly, or their S's and Z's, that they have a lisp, because they're not teased, but the parent knows it. And we know as a parent that they're going to get in high school and maybe their peers aren't going to say something, but they're going to be looked over for things.
Yeah.
For scholarships, for, offices, they're going to be looked over. And as parents, we want to take care of that and give them every opportunity possible.
Yeah. Great advice. Are there things I can do with my infant to prevent speech and other myofunctional issues in the future?
Absolutely. Ditch the pacifier as soon as we can. Lose the sippy cup. Work on that lip closure. There's blow bubbles, blow raspberries. Give them foods that they have to chew. Stay away from the pouches, those soft foods. Go ahead. When you move them to table food, move them to things that they have to chew. That's going to facilitate the growth that we want, not only in the jaws, but in the palate as well.
And I would add this, whatever age your child is, take them to, an OMT or a dentist that's really adept at airway and myofunctional issues, and have them evaluated for a tongue tie. Lip ties, even an infant. If your infant were not evaluated, you need to take them in. Dr. Corridor does the infant releases in our practice. So an exam on an infant, you might want to shed a little light on that. So you've got mom and dad that just had a baby a week ago. What should they be looking for? Like if they lift the baby's tongue up, and what are some things they should be looking for? Absolutely.
Well, definitely, breastfeeding, how is the baby latching on? Because that's going to be, telling us on if there's a lip restriction or if there's a tongue restriction.
So if they don't latch well, that could possibly be there's a tongue or lip restriction.
Absolutely. Okay. Colicky, is the baby colicky? Because if they're not producing a good latch, then they're swallowing a lot of air, and that can produce some of that.
Here's a great question. Are there things that I can do with my infant to prevent speech and myo issues in the future?
That's a good question. Absolutely. Ditch the pacifier as soon as you can. Move to an open rim cup like we talked about, and work on keeping those lips closed.
Okay.
Make a lot of sounds, blow bubbles, do a lot of imitating of the mouth.
Yeah, those are good, and those are things anybody can do.
Absolutely.
Yeah, great. What is the importance of a tongue and lip revision, or if a child has a tongue tie? And before you answer that, I want to. A lot of people think a tongue tie is where the tip of your tongue is down and you can't lift the tip up. But we know that what we call a posterior tongue tie is a little bit further back. It's not like in the back of your throat, but those are a little bit harder to diagnose. Those really need to be diagnosed at a healthcare professional, like at our office or in the hospital when the baby's born. But what's the importance of freeing that tongue and lip up?
It's important because it can impact speech development. Okay, it also can make them become picky eaters. Because they intuitively know it's hard for them to control certain substances, because maybe they can't get the back of their tongue up and back like they need to, or can't lateralize their food. So those are the kids who are going to put tons of food in their mouth. They're the kids that are going to stuff their mouth. Why? Because they can handle more. They can handle more rather than less. Does that make sense?
Yeah, perfect.
So those kiddos who are picky eaters, generally they have, we need to look and see.
Yeah. And a child is not going to say, hey, Mom, I have a tongue tie. We need to go get it taken care of. That's all they know.
That's all they've ever known.
That's all they've ever known, yeah.
It's normal to them.
You watch them and they're smacking, there's a lot of a lot of movement of that face, a lot of compensations. It's a pretty significant red flag right there. Like, why is that going on? If they're smacking a lot, they're losing food from their mouth.
Yeah.
Could be a reason.
So if you don't mind, if you have some water left, would you like imitate, like if a parent, you give the kid some water and swallow, show us like what a healthy swallow would look like.
A healthy swallow, and I'm happy to do it, is I say a statue face swallow. I want to see a statue face swallow. I don't want to see anything move when you swallow. So here we go. Okay? This is what you don't want to see. See that grimace?
Right. Yep.
Sometimes they'll pocket the water, they'll kind of hold it in their cheeks first, or most of the time you're going to see an effortful swallow. You don't want to see that.
Right.
You shouldn't see that.
And that also, you know, for the just aesthetic reasons, leads to premature wrinkling of the face.
None of us want that.
You're doing that. How many times a day? How many times a day do we swallow? We know, we've seen the research on it.
Right.
2,000 to 3,000 times a day. So basically a pathological movement of muscle 2,000 or 3,000 times a day.
Or behavior that's being enforced that many times.
So, yeah, exactly.
That's a hard behavior to break if you don't, you know, if you're not equipped with the right
one of the
exercises or situations, you know, development, you don't know.
One of the very last things I do in my program is we work on natural saliva swallows, because we work on drinking, we work on eating, but then we have to swallow saliva right all day long. And so that's a really fun activity because it really hones in on how many times do I swallow my saliva correctly throughout the day. And I give my patients a little clicker, and they click every time they think about that they swallowed correctly.
Yeah.
So
Interesting.
it's a fun way to make sure we've integrated and habituated the new swallow.
Yeah. Great. Well, some great answers to some really great questions. Kimberly, thank you once again for being on. We'll definitely have Kimberly on again because this is a profession and a science that it continually develops, and anytime we learn things new, we like to share them with our listeners. So.
And we couldn't do what we do every day without you.
Right.
I mean, we reinforcing to a patient and helping them get on the right path of growth and development. I mean, that's an essential, crucial part on their getting healthier and developing, and for us to be able to do our treatment and to help that patient. Yeah, we can't. So important.
And I would tell any dentist out there that are doing this type of treatment, if you don't have a myofunctional therapist on your team, it's like having a baseball team without a third baseman or a football team without a left tackle. So, you know, it's the integral part. Kimberly is an integral part of our team. If you go on our website, she is on our website. She doesn't work in our practice, but she's just a part of our team as anybody that is in their physical practice on a day-to-day basis. So for that, I'd say thank you. We both do.
Yes.
Thank you.
It's been, and all of our patients loved Kimberly. And I would have to say all the myofunctional therapists I've ever met were, you know, really genuine, caring people. And, you know, some just have more experience than others, and Kimberly has a lot. So, and her licensed speech pathology degree is that's huge because she can kind of cover a lot of bases with, you know, with one therapy. Right. So, and that would be my last question to ask you before we go. You don't always integrate speech pathology treatment with your patients, but sometimes with your speech pathology patients, you also integrate oral myofunctional therapy. That's
right.
Is that accurate?
All patients don't need myofunctional therapy, and all myofunctional therapy patients don't need speech therapy. So many patients come to me and their speech is absolutely fine.
Would you say more people need out there, just as the population in general, need oral myofunctional therapy more than the speech pathology patients?
Absolutely, absolutely, because it impacts swallowing.
Yeah.
Swallowing and eating, chewing and breathing.
Yeah, and it's something that a speech issue is something that's more easily seen. You know, like it's like people that are really obese. You look at them and say they're, you know, a heart attack waiting to happen. But how many times do you hear of someone that's fit? You know, they run marathons and they drop dead of a heart attack. those are the people that never go do anything about it because they don't know.
Yep.
And I think with myofunctional therapy, from what we see, and of course we're dealing with people that are coming to us for a specific reason, but just in observing the general public, I would say the majority of people would benefit from myofunctional therapy.
I would agree.
So
Yeah.
I think it would be something that would be a really, for some people it would change their lives. So for some people it would be a really nice life enhancement. So, you know, if for no other reason that you can go out to eat at a restaurant and not spew your food all over the place
That's
and
important.
embarrass yourself, which as a child they don't care, but as an adult
Well,
that
big
would
deal.
get a little embarrassing. So I know a few people like that.
Yes, we do.
Well, Kimberly, thank you so much.
Thank
Dr. Corridor, Adriana, thank you for being with us today too.
Thank you.
And this has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. We will see you next time. Have a great day and have a great week till we see you next week. Bye-bye.